Hello, everyone. My name is Drusilla Batiste, and I'm here to share some research that I've gathered over anemia in Afghanistan. So let's go ahead and dive right on in. So what is anemia? Anemia, as a broad definition, would be when your hemoglobin concentration or the levels in your blood go below a certain level that's been determined for the demographic in your area and your population. There's cutoff points are generally determined by things such as gender, your age, your sex, your physiological status, your altitude, and smoking habits. Some of the causes for anemia would be iron deficiency, which is the most popular, autoimmune diseases, cancer, and malnutrition. So let's go ahead and talk and look at some of the numbers in our numerical statistics section. So there are currently 2 billion individuals on the planet that suffer from anemia, roughly at least, right? And of those individuals, 41% to 50% are actually pregnant women. For Afghanistan specifically, some of the numbers that we have here are over 60% of children in the country have anemia, and then over 40% of women pregnant or of the age to be pregnant have anemia. So some of that correlation comes into mothers passing it down or general family units having anemia. So some other numbers in relation to Afghanistan, giving some of its background, not so much in anemia, but just to give you a background of the country so that you're kind of well aware of the bigger picture. There's about a 60% poverty rate in Afghanistan, and that is rising as the years go on. There's also about a 30% of the population which is currently suffering from food insecurity, and sadly, this statistic is also going up as the years go on. Some more information on Afghanistan. They've been in war for about 20 years now, just kind of constant struggle and strife, which leads to political unrest. So they've been dealing with that for about 20 years as we speak. They also suffer from a lack of economic stability and lack of economic opportunities. That is, of course, stemming from the wars and the coups and all of that kind of turbulence that's happening within the Afghanistan government. Then it trickles down and it causes the economy to be unstable as well. Again, kind of stemming from the war problem, many live in unsanitary conditions. This could either be indirectly because of the war, for homes being destroyed or kind of public sanitation houses being destroyed, or it could be because of the economics, which again leads back to the war, wherein families and the government itself simply does not have the money to allocate to providing more sanitary conditions for its citizens. Overall, there's just a lack of proper health care. Again, they have a lot going on in the country right now, which leads to that lack of proper health care. And there's widespread food insecurity, as I mentioned before, that 30% and rising. Food is not only scarce, it's not always clean, which just tumbles right back into each other, right? So one thing can cause so much strife further down the line. All of these factors just kind of merge and meld together to kind of create this overall problem. But going back to the conversation of anemia, let's talk about prevention strategies, primary and secondary. Primary prevention strategies, one of the absolute biggest ones is prophylactic iron and folic acid supplements. This will either be abbreviated as PIFA or just IFA, depending on what literature you look at. I have it here as IFA. So the IFA is administered to women and children, whether they have anemia or not. Of course, this is great for people who do have anemia. It gets them up to sustainable levels. And for people who don't, it keeps them at sustainable levels. It's helping everybody. These drugs are administered due to strict guidelines per age group. So every age group has a specific set of rules on how it is to be administered to this age group. Younger kids, of course, would get more help with it, and the older adults would get less. Treatment for affected groups. Great way to prevent it continuing to spiraling is to treat people that already have it. So they're doing testing across all groups. Again, whether you have anemia or you don't have anemia, this testing is being done. And then after that, you are being evaluated according to your individual hemoglobin levels. And from that, they take that information and give you a personal care plan to keep you on track. There's also a K for Health anemic prevention program, which has like control toolkits. And this was used and created with the WHO guidelines in mind in order to be handed out to at-risk communities. So secondary prevention strategies, we've got year-round behavior change communication. This would be repetition, using repetition in order to make the concept stick and to create habits. On top of this repetition, we're doing things such as sensationalizing meetings, having year-round ads, communication packages, and etc. They're also doing deworming. Now, deworming doesn't seem like something that has direct consequences to anemia. However, getting rid of some of these other diseases helps your body actually gain the strength to deal with the anemia itself. So there's annual mass dewormings and national deworming days that run from February to August. Malaria control is another secondary prevention strategy. Malaria will wreak havoc on a body that's been weakened by anemia. So dealing with malaria helps the body actually have time to deal with the initial anemia. Keep in mind that all of these prevention strategies are unfortunately not really being actively implemented in Afghanistan itself. The country is simply in too much turmoil and going through too much to implement these programs right now themselves. So all of this information that I'm pulling from and just pulled from was actually from other countries, mainly India. So challenges, barriers, and recommendations. Some of the challenges we have: individuality, treatment, time, and motivation. Individuality, every single person is different. They will react to medications differently, which means they will need different care plans. The treatment itself may take very long and require intensive work between the person and their primary care provider. The motivation, getting a life-changing diagnosis and going through things like chemo and other intensive therapy programs can be very demoralizing, and it's important to keep your morale up. However, this is a challenge when you're going through something so difficult. Some of the barriers immediately off the bat: access. Access is an incredible barrier to healthcare. If they can't get to you, then you can't get the healthcare. And if they can't even hand out the information, then people suffer. Language is another barrier. There are so many languages spoken throughout the world, and a lot of times literature that's created is created in languages that don't exactly reach some of the communities that actually have some of the highest numbers of anemia, which is a problem. Communication barriers as well can prevent good communication between the person suffering and their healthcare provider. They can't properly express themselves on what they're feeling, which leads to, not on purpose, but less quality care. And then some recommendations for Afghanistan as a whole. Information needs to be handed out. It needs to be provided so that the people know what to do and how to do it, how to take care of themselves the best that they can. Of course, as previously mentioned, this would be difficult, but it is a recommendation. Transplants are incredibly effective for more aggressive forms of anemia. These would be like bone marrow transplants. Incredibly effective. More literature needs to be put out about that, and that as an option needs to have more research put into it. And then inclusivity kind of goes back to some of the other points: cultural, language, all of that. Inclusivity for everyone in those spheres is incredibly important in order to make sure healthcare is being provided in an adequate manner. Finally, just to wrap everything up, Afghanistan's currently struggling with increasing anemia numbers as well as poverty and malnutrition. So there's just kind of a lot of problems going on in that country. In order to improve these rates, we would need to kind of fix the country from the ground up, improve some things like nutrition, the sanitation, communication, their healthcare systems. And then just to wrap it all up in a bow, there are 17 sustainable development goals that were kind of put out by the WHO. However, I just want to focus in on two that would really benefit Afghanistan personally. One of those would be the good health and well-being, which is SDG number 3. And the second one is the quality education, SDG number 4. I believe those two as a whole completely sum up what this presentation has been about, and the research that I found, that caring about the people and healing them in a holistic manner, as well as providing the education to keep themselves healthy, will just drastically increase everyone's quality of life. Well, that's all I have today. If you have any questions, you can go ahead and refer to the emails provided later in these slides. Thank you so much for listening.